Let's talk about spinal decompression. So symptoms that could be related to a herniated disc that may cause you the irritation or even pain might lead to something where you have numbness, tingling, you could have burning sensitivity, and you get some type of drop arm or even legs actually feel like they're giving out. Take this as an example of a herniated disc. You can see that this actually is putting a little bit of pressure onto what is representing a nerve. So this particular region with the pressure onto that nerve can cause the symptoms that are related to numbness, tingling, or even pain or pressure onto an area of your lower back. An example would be this particular nerve root. So it goes down to the lower extremities, such as your legs, and it can cause a lot of irritation. But we would do the spinal decompression to actually reduce the symptoms that are related to it by decompressing that region. And as you can see, it starts to rehydrate the nutrients that are rich into a disc. So benefits of spinal decompression can include, of course, pain relief, improved mobility into the region. It's non-invasive and non-surgical. It's low risk, and patients usually fall asleep comfortably onto the table. And it's very cost effective because it does reduce the fact that you wouldn't have to worry about any more medical intervention. How long would it take to actually work onto a disc to decompress it? Well, it depends on how bad it is, and there's different levels of herniations of a disc. So you could have the standard classic degeneration where it's more or less age related is more or less the term versus a prolapse or a bulge. If the disc is bulged, then technically it's just putting a little bit of pressure into the region and of course irritating the nerve, which is easy to address with the decompression with fewer sessions. However, if it's actually a lot worse and it gets to the point of not necessarily an extrusion or as you see here, a sequestration, these are big terms, but this is actually really more of a medical problem. Into the side of between a protrusion and a bulge, that herniation can be addressed by multiple factors and especially doing the spinal decompression over some time. Now, it wouldn't take just about 3 or 4 sessions, so there may be some that would be determined, of course, by your doctor, and we would basically set up the program to go beyond the 10 or possibly even more sessions. But this way, we can actually truly address the disc enough so that it starts to rehydrate, it retracts, and yes, you begin to actually decompress the disc.